Hi dear patients, this is Dr.Serkan. Let's talk about the BBL again. So there are some challenging BBL cases for us. The hip dip areas, it's really problematic area. Even the patient has got enough fat to put at the hip dips and to fill the hip dips, but we usually cannot achieve a really nice result in one session. It's because of this. It's very simple. Okay, you have the fat, you have enough fat, and you have a place to inject the fat. But the important thing is the fat is going to fill the butt in all areas, but in some areas it doesn't work properly. It's like this. This is the skin, this is the muscle, and this is the fatty tissues that you have in your bum. So our injection levels is always above the muscle. So if this is the muscle, if I'm going to make the injection has to be above the muscle. So there are only a limited space in your body to inject the fat. We have to put everything equally in all sides, and we want the skin to expand with the skin fat grafting. So if you inject the fat and if the skin has expansion capacity, it means that yes, the fat cells has more potential to survive and you will have more fat cells, and it means that you will have more volume on all areas. But hip dip is quite different. In some patients, not in the all hip dip patients, but in some patients, the skin on the hip dip is just connected to the muscles with a very strong attachment, and it just pulls the skin like this. And the fat grafting does not work properly because even you inject the fat in these areas, the attachments between the muscle and the skin, they don't allow the skin to expand. So if the skin does not expand, it cannot take more fat, and it gives a level difference. Think, this is the hip dip and this is the normal area. I'm going to inject the fat all sides. Here these tissues can expand with the fat, but here the attachments pull the skin and it doesn't let the skin to expand. It means that when you have one session BBL and if you have a very strong attachments in the hip dip areas, you will definitely not, the surgeon is going to be not definitely possible to do filling your hip dips at once. Probably you may need a second or third session. So if the patient has very strong attachments in the hip dip areas, it's very challenging for the surgeon. And for me, I always touch the patient's skin, I see the attachments, I see the tissue softness, then I tell the patient that you may need a second session in the future. It's so important. You have to understand the mechanism. It's your butt is not like a balloon. You cannot put everything inside the butt, and you cannot have a cool shape in all areas. In some part of the butt you have thicker skin, in some parts you have smaller part of skin. So the expansion capacity of the skin is not the same, and also when you inject the fat, the thicker areas is going to take more fat, but the slimmer areas is going to take less fat, and it's going to make a uneven tissues on your buttocks. So even in experienced hands, you may need a second session to fill the hip dips or to fill the irregularities, because the surgeon or nobody knows exactly how many percentage of the fat cells will survive. For me, for my technique, if the patient has an hip dip and if it is so deep and the attachments are so strong, I always start with the injecting first the hip dips. I see the expansion capacity of the skin on the hip dips and I just inject the other sides again. If the patient has good expansion capacity on the skin, especially on the hip dip area, so I try to fill it a little bit more. It's called as overcorrection, and I'm trying to make an overcorrection for the hip dip area, because everybody knows that most of the fat cells will not survive. So after 6 months or 9 months, the overcorrection areas is going to be smaller and all the sides is going to catch each other. Even with this technique, we cannot achieve 100% of course satisfaction, but when you're having a BBL surgery, you have to talk with your surgeon and you always be ready for another session for maybe for a revision or maybe for a small touch again. Thank you.